Hey guys, welcome to the I Hope to Hear This podcast. And we have a returning guest, Miss Solina Chiang.
Hi.
Hello. And okay, so just full disclosure, I stopped the recording like 2 minutes into it because I had to set up something. But the first time around, we could see the balloons in the background, which we cannot anymore. But there it is. Yeah. So yeah, you recently celebrated something, right?
Yeah, it was my birthday. Woo woo. I turned 26.
And the question that you were in the middle of answering before I had to cut you off was, how was it kind of, celebrating your birthday? Because I'm assuming this is your first birthday that you celebrated while on lockdown and on quarantine, right?
Yeah, it was actually really fun. First, it started off, well, I didn't know so many people were going to be coming over to drop off stuff.
Mm.
I think Connor knew because a lot of people texted Connor to tell them that they were going to drop off gifts and cupcakes and cake and donuts. And so the entire day from noon till literally like 9 p.m., someone was dropping something off. And
Wow.
in between the times, um, Connor and I would just like, we were so exhausted from all the from all the people coming by. We would just like sit in silence and just wait till the next person came.
Aw.
But it was super fun, and it was just good to like see people's faces and catch up with people from 6 feet away. And I felt super loved. And at the end of the day, Connor set up this Zoom call with all my best girlfriends,
Hmm.
and all my girlfriends just spent the time encouraging me, which was super uncomfortable, but also really amazing.
Wow. So was it like people kind of took turns just giving you an encouraging word, or
Yeah.
wow, that's
Just
awesome.
saying like how thankful they are or what I've done to, I don't know. They were just super encouraging, and they actually recorded it on Zoom so that I could see it later because I was really overwhelmed.
Aw.
Yeah,
And
it was
that's
just
I'm really glad that you were able to celebrate your birthday that way. Especially because for those of the listeners who do not know, Selena is a nurse. She is well. I think I've mentioned you in almost every single one of my podcasts in the recent 3 weeks because I'm always giving you a shout out. And it's because you're not only are you a nurse, but you are actually part of the COVID team at your hospital, right?
yeah. So it's such a funny story. So the first day that I had to work with COVID patients, I didn't know that I had to work with COVID patients, and they hadn't rolled out any like official policies, or like they haven't put in things in place for the nurses to go through training in order to understand how we should be taking care of them and all this stuff.
Mm.
It was only like specific people on the unit that knew those policies and procedures. And I got floated. So normally I'm on a cardiac surgical unit, and that day that I first took care of COVID patients, I was floated to this floor, this like random med surge floor, and I had 5 patients, which is insane because the load that I received on my shift was so heavy. Like
Mm.
I don't even remember exactly what happened, but I remember I had one patient on restraints. I had another person that was confused, and I had another one that couldn't walk, or he had like an amputated leg, and he was peeing all over the floor. Like it was it was one of the worst days I had in so long. And then on top of that, 3 of them were PUI patients, which is persons under investigation, which means that we were waiting for their COVID results to come back.
Oh, wow.
So I had to like wear the all my protection equipment,
Mhm.
and then
So when you say that you floated to that floor, does that mean you were just kind of floating to a different unit? Is that what
yeah.
okay.
So what was happening at that time? This was about, I think this was 2 months ago. It must have been something. It was like right when this was all happening.
Hmm.
Um, they started stopping the elective cardiac surgeries,
Mm.
and so we stopped getting a lot of patients. So because my floor was decreasing in the number of patients, they didn't need as many nurses. So they would send our nurses to be floated to other floors. to help other needs in the hospital.
Oh, wow. So let me ask you
And
something.
yeah,
Oh, sorry. Just one question about, because what I've read and heard a lot is that even though this pandemic is going crazy, there are a lot of nurses being told to go home, or like laid off because these elective surgeries aren't happening anymore. Have you seen any of that happening in your hospital, or are all the nurses supporting, those departments that aren't, I don't know, essential right now?
being
Or are they
utilized. Yeah.
right? Are they just being loaned to the COVID units?
Yeah. So, okay. So let me just tell you how this all went down.
Yeah, yeah.
All right. So after that one shift where I was floated, the next day I came back and our acute care specialty director came down to our floor during shift change, and she said, all right, guys, she was talking to my unit, 2 South. This is our cardiac surgical unit. And she said that our floor was going to be the first floor to be designated as the COVID-19 unit. So all of the COVID patients would be coming to our floor now. So our whole unit would be all isolation, and they locked our doors. So you have to have a badge to get in. And we had no visitors. Like, everything was basically shut down to the point where like they wanted to train our nurses to do all the IV sticks, do all the blood draws, clean the rooms for the environmental specialty people, and they minimized the amount of staff that was coming in. So that morning when they announced that, everyone's faces like dropped. We were all like, we were so scared because we were the first of all, like, we aren't normally a med surg floor, so we don't usually see that many people who are confused or who have like lots of comorbidities. It's usually just like someone comes in, has a heart attack, has to get heart surgery. I know it doesn't, I mean, that sounds pretty bad too, but there's like, we see a very niche group of people, and yeah, all of our faces, we were just silent for like 10 minutes as they were just describing how things were going to go from now on, and how the reason why they chose our unit was because they can transform the rooms to ICU rooms. And I almost started crying because nobody wanted to volunteer. But eventually they didn't even ask for volunteers. All of us just ended up having to be part of the unit. So all that to say, to answer your original question, the personal protective equipment portion of it, we have these things called buddies, and I don't think they have this on in every hospital, but this is just how Emory has been doing it. They basically have these buddies to help us don our protective equipment and then doff our protective equipment, because we've had a lot of nurses and doctors and respiratory therapists and physical therapists, like every care team, there has been an issue with someone going into a patient's room without having the correct protective equipment on, putting them in danger of getting COVID. So we have this policy where you have to, and obviously if there's an emergency or if there's something going on and you have to get into the patient's room quickly and you don't have a buddy, like, you can go into the room and just make sure you have everything on. But most of the time we try to have our buddies look at us, make sure we have everything on before we enter the room, and then come out of the room appropriately so that we're not contaminating the nurses station and the hallways and things like that. Then on top of that, we have people who are cleaning the nurses station and everything. So every 4 hours, we're constantly cleaning high-touch surfaces like doorknobs, tables, the computers, the phones, anything that's a lot of people access. We're constantly cleaning that. But since the nurses are busy, we have buddies who do that too. So one of the things that I've seen is a lot of physical therapists have been doing that for us because their caseload is not as big right now. And then a lot of people in like pre-surgical areas like the PACU or this place called ARU. Now that I'm saying that, I can't remember what it's exactly called. But there are certain areas of the hospital where they're just not needed right now, and so they'll be redeployed to different areas of the hospital. Some of them just get stuck, like like so in the front, when people enter into the hospital, you have to have a badge in order to get in. So visitors obviously cannot get in. Sometimes the physical therapists are redeployed to the front of the hospital to act as security.
Wow.
Yeah, so that's how they're like trying to help people maintain their hours, so that they don't have to use their PTO and so that they don't have to be laid off. But there's one exception. So there's this thing called Emory staffing pool, and they don't have PTO, but they get paid more than us hourly, and they don't have like any benefits or anything like that. They just come work hourly, and they come kind of like on an as needed basis. But since there's not really a huge need for them, I personally know a couple ESP nurses, and they told me that they keep getting called off, and they don't have PTO to rely on. So if they don't work, then they don't get paid. So I've definitely seen that happen. But again, Emory has actually been doing a really good job of taking care of the Emory staffing pool as well by using them as buddies and redeploying them. Instead of them acting as nurses, they just have to kind of do other activities in the hospital that need support.
Gotcha. So in order to mitigate the layoffs, to lessen it as much as possible, they're just being deployed to, even if it's not directly being a nurse for these COVID patients, there are other things that need to be done. So they're being deployed there, right?
Yeah.
Oh, wow. So then when you describe the 5 people that you met on your first day, they all sound like, so are they in the hospital because of COVID, or were they in the hospital for other things, but they were just sequestered to a different area because they had the potential to have COVID?
Okay, so the floor that I got floated to,
Mm-hmm.
it's like a med surg floor. So if they don't meet the criteria of other areas of the hospital, like cardiology or like orthopedics or anything like that, usually the people that end up there are people who have like the flu or who are like septic and they have to get antibiotics, or someone who has pneumonia. Those kinds of people kind of go to the med surg for. It's kind of like a catch-all unit. So even if let's say other areas of the hospital are full, then they'll just go to the med surg for. So because it's kind of like a catch-all unit, the patients that I had, they may have been there for another reason, but they may have been showing signs of COVID. So they were tested for it, and then because they were tested for it, they were considered a PUI, which is again, this person's under investigation. So 3 of them were PUIs, and then the other 2 were just like they had other issues going on.
Gotcha. So then for you right now, you're still part of the COVID team, right?
Yeah, so my unit now, not the unit that I floated to, but the home unit that I'm normally at, it's all COVID patients, and then if their testing comes back negative, they're immediately transferred to another floor because we're trying to isolate all the COVID patients into one unit. But since our unit opened, 3 other units have opened as well.
Wow. And so have you had any COVID positive patients in your unit?
They're all COVID positive patients.
Oh, okay,
Yeah.
gotcha. So as soon as they're okay, that's when you move them. Gotcha. Wow. So then, like, how does that play, like, mentally? Like, how does that affect you, like, emotionally and mentally, knowing that every day you go into work, you are potentially risking getting, the coronavirus?
Yeah, I cried the first day. I cried when they told us that we were going to be a COVID unit, not because I was scared of the virus, but because like I think I was just overwhelmed because I had a bad day when I floated, and then they were telling us that we're going to become the new COVID unit. And usually, so just so you guys understand kind of like how the hospital works, um, usually if there's someone on isolation, the nurse has no more than one person like on isolation. So let's say you have three patients, 3 or 4 patients, you'll only ever have one person maybe on isolation for some reason, because they usually try to disperse it between the nurses. So like, let's say we have like 4 people on isolation in the unit, then like each nurse will get one isolation patient so that we're not, because the process of donning and doffing is a little tedious and it takes a little bit more time. So it would be unfair for a nurse to have more than one isolation patient. But now they're asking for all of our patients to be on isolation. And so our nurse to patient ratio went from 4 patients to 1 nurse to 2 patients to 1 nurse, which was like unheard of. Like, I believe in New York, this is what I heard. I heard that one nurse in the beginning of all of this, 1 nurse would take care of 25 patients on their own.
Wow.
And that's why there's these scary stories coming out of New York where the nurses feel like they're not taking care of their patients, and literally have used the words like murder and like it's basically a death sentence going into the hospital. I think it's gotten better now because a lot of nurses volunteer to go to New York. I heard at one point it was like, for a while it was 12 patients to 1 nurse. I think the 25 was an extreme case, but I think the norm there was 12 patients to 1 nurse. But they have gotten a lot more support now. But mentally, I think what was messing me up was when you go into the hospital, it already feels dirty. Like, I've never gone into the hospital and I'm like, oh, this is a clean place. Like, when I go to work, like, I know that there's probably germs everywhere. But now that and you can't see it. That's what's so, that's like the hard part. Like, I'm like, if I touch this, does this mean I'm going to get it? Or like, if I'm going to the elevator, I don't use my finger anymore to push the buttons. I use my elbow. And then if I like need to open a door, I never use my hand. I always use like my arm or something like that. So I definitely am just more conscious of like what I'm touching, what I'm cleaning. And the hard part is when I come home and I don't, like, let's say I'm asymptomatic, like I just mentally, I had to get over the barrier of thinking that I probably was gonna give it to Connor, who's my husband. And yeah, I think that's what I was scared about the most, was like giving it to Connor. But then at the same time, like, it wouldn't be realistic for me to quarantine myself for however many months when we're living in the same space with each other.
Right.
So we just have to make that decision together, because it's not like I can just cook food and then eat on this side of the table and like live in a different bed. I don't know.
Yeah. No,
It just wasn't.
and because most of the people who quarantine themselves, they just do it for 2 weeks, right? Because they think they might have gotten it and they quarantine themselves for 2 weeks, and then after the 2 weeks, it's like, oh, I'm all better, or I'm allowed to like talk to you and interact with you. But for you, because you're constantly in, the presence of people who have COVID, like you never know when the virus might have entered your body or your system, right?
Yeah.
Wow.
And I think we had 3 nurses on our floor that got it. And then there were some other nurses. I don't know about the other units, but I do know another nurse on another unit who got it as well. So I don't know if they got it from the hospital or if they got it elsewhere, but it's just, I definitely go into work thinking this could be the day.
So what happens when a nurse gets it? Do they get hospitalized? Do they go home, or like what's the procedure there?
They just so if you start noticing symptoms, they tell you to call our COVID hotline, and and then they ask about your symptoms and like kind of figure out whether or not you should be tested. But they've been really lenient for the employees. So we just go ahead and get tested. And then if we come back positive, then I believe we have to stay home and not work until, is it 5 or 7 days? So we have to be not showing symptoms for like 5 or 7 days or something like that. I don't remember. And then once you have stopped showing symptoms for a while, then you, I believe you call the COVID hotline again, and then they have to clear you to come back to work.
Wow.
Usually takes about 2 to 3 weeks.
Gotcha. Do you feel like you guys as nurses, do you guys have enough protective equipment to keep you guys from getting the virus, or have you guys seen any shortages or anything like that?
Well, there have been shortages, but in comparison to like what we've seen on the news with New York, I don't even feel like I have the right to complain. But normally, in a normal situation, those N95 masks that everyone talks about are supposed to be used once. Like, you're not supposed to use it more than one time. Mm-hmm. But now our policy is to use one for a full week. So for it to be used for 3 shifts. Wow. And honestly, like, I guess it's working because I'm not sick, but at the same time, like, it has worked for sure. Mm-hmm. But at the same time, like, if the droplets, if they sneeze or cough, if the droplets get onto my mask and then I have to take it off and put it in this brown bag, then it can definitely contaminate the brown bag. And then as I'm picking it up to put it back on, I could be contaminating my face as I'm putting it on.
Oh, wow.
So there's definitely, like, I can see how I could contaminate myself very quickly and easily. But at the same time, we have a face shield as well. So the face shield, if someone coughs, it's going to hit the face shield before it hits my mask. So it's okay. I mean, in Georgia, it's okay. It's not like to the point where I feel like it's unsafe.
Gotcha. So you
just
talked
not ideal.
Right. So you talked about a few things, that some of the hardships that you're going through, like mental and like anxiety, and having to look after these patients that aren't ideal. So I mean, you could include all of these in the list if you want, but what are some of the hardest things about the transition from like a cardiac unit nurse to suddenly having to deal with and take care of COVID patients?
So on our unit, the nurses are now required to do the IV6, like I said before. So usually we have an IV team. So if we need an IV, we just call the team and then they put an IV for us. And then we usually have a phlebotomist who draws blood for us. Mm-hmm. And we usually have environmental services who cleans the rooms for us and gets our trash and all this stuff, and then cleans down our floors. I think the hardest part about transitioning is the amount of time that we spend in the rooms, and then a lot of the patients on our floor have a lot of comorbidities. And the reason why is arguably my floor is probably the hardest COVID floor to work on, because we have these dialysis water port things in our rooms where the patients can get dialysis in the room instead of having to be transported to the dialysis floor. So all patients who are COVID positive and who are on dialysis come to our unit. Now, if they're on dialysis, that means they have chronic kidney disease. And if they have chronic kidney disease, they probably have other comorbidities on top of that, like diabetes, heart failure, who knows what else, hyperlipidemia, CAD. They probably have a lot of stuff going on. And we've seen that a lot of these patients are so sick because they not only need dialysis, but they they have this virus that is affecting their lungs and their respiratory system, and they are deteriorating pretty quickly. So what's the reason why I brought up the nurses having to learn these new skills, and then also having to deal with the high acuity of these patients, is because those two combined makes us have to be in the rooms for like 1 or 2 hours, when normally we're usually only in a patient's room for about 20 to 30 minutes at a time.
Wow.
So, and on top of that, we have this like life-sucking mask that you can't even breathe in. And you have this like huge face shield and this gown over you, so you're like sweating. And I mean, literally last week I was charge nurse, or this past week on Monday I was the charge nurse for our unit, and the charge nurses don't have any patients, but we kind of help the rest of the floor out. I was in this patient's room with another nurse for 2 hours because he was having a lot of issues. There was a lot of issues with his feeding tube. He had like a Dopphoff, which is like a tube that goes through your nose and down to your stomach, because he was confused and he was having swallowing issues. He was on restraints. He had mittens on, and then he had soft wrist restraints, and he kept trying to pull everything off. He had to get blood because his hemoglobin was really low, and he thankfully he wasn't having any trouble breathing, so he was actually just on room air. He didn't need any oxygen needs. But it was just a combination of like everything that was going on with this patient, and it was like 5 o'clock, and it's almost time where we're trying to get things all settled so that we can get ready for shift report. And the doctor just started having us do all this stuff for this patient, and you just get stuck in these rooms for hours on end because you have to do all these things for them. We had to draw blood during that time. We had to draw blood and give him a new IV. So yeah, it's just there's a lot of stuff there's like a lot of things that like we normally used to not have to do, and then there's a lot of things that like there are a lot of comorbidities that these patients have, specifically because they're on our floor, because we have the access to those dialysis ports in our room. I don't know about other floors. I'm sure that there are some other COVID units have these kinds of patients too, but I think our floor is definitely special because of the high acuity of all of these patients.
Wow. So not only do you have to learn all these new skills and use them every day, but just employing those new skills increases your likelihood of possibly getting the virus, right? So you're saying, is it the actual learning of the new skills that's the most difficult, or just the extended amount of time that you have to spend with your patients?
I think it's like the combination of having to utilize those new skills and also take care of a high acuity patient on top of the how fast a patient can deteriorate from this.
Oh, gotcha. Wow. So have you guys seen any, all the patients that you deal with are COVID positive. Have you seen any of them kind of, I don't know how to put this delicately, but have you had patients that, lost the battle against COVID?
So we have, but also it's not just because of COVID. Like I said, on my unit, we have patients who have a lot of things going on, a lot of comorbidities, a lot of already known health problems, and kind of basically COVID kind of pushed them over the edge, I would say.
I see.
I don't think, because I think like, if most of the people who are getting COVID, who have been healthy, who are young, they're able to get over it within 2 weeks and go about their lives. But yeah, I mean, we've seen deaths, and I've seen a lot of patients go to the ICU, because my unit's not an ICU. So once we start to see them deteriorate, we immediately send them to the ICU. But yeah, I think the reason why we're seeing deaths and things like that is because of underlying health issues that have already been there.
Gotcha. But it's that the complicated, I mean, the issues that complicate their health issues on top of what they already have is the fact that, you know, the breathing abilities start to deteriorate because of COVID. Is that what it is?
Yeah.
Gotcha.
Yeah. And so like any respiratory virus can do this. So like if you just, and I think I still have a lot more, I really believe that like if you have information about COVID, it should be evidence-based and it should be highly researched. So I don't want to say anything that like is not correct. But what we've seen with COVID patients is that a lot of them who end up in the hospital have gotten pneumonia, and the effects of having pneumonia is what's causing them to start to feel the effects of COVID, having like these breathing issues and things like that. Almost every single patient that we've had on our floor has had a positive COVID, and then their chest X-ray is showing really bad pneumonia.
Interesting.
Yeah.
Are they related? Like, can having COVID like increase the likelihood that you'll get pneumonia, or are they coincidental?
Yeah, for sure. So it's like for every respiratory virus, like pneumonia can be like a consequence of any kind of respiratory virus, or a bacterial infection. So yeah, that it's just a complication of COVID.
Gotcha. So I want to ask a question, because you were on, I forget how long ago, but you were on with your husband on this podcast.
Yeah.
I want to say it was right before COVID-19 started getting really bad.
Yeah.
And I remember saying, so what do you guys think about this coronavirus? And your response at the time was, it's kind of ironic because you were like, oh, it's just like the flu. It's not a big deal, right? And so do you feel like now that you're in the middle of it, kind of, because what we see in the news, obviously it's really bad because people don't have, I mean, there's no vaccines, so it's spreading really quickly, so all of that, and it's making all of us scared. But kind of looking at it firsthand, you know, having dealt with people who might have had other respiratory illnesses, do you still feel like COVID-19 is kind of run-of-the-mill respiratory illness, or is there something different about it?
So I think I had a poor understanding of the flu as well. And I think a lot of Americans have a poor understanding of the flu too.
Interesting.
I do think it's worse than the flu. I'll say that. But I think that I was talking to a nurse who was an ED nurse, and she was just telling me about flu season, and I was blown away. She said it's like a war zone, because if you think about like the amount of cases the flu brings in comparison to how many cases the COVID brought in for Georgia, flu for sure wins out. But so she was explaining like the flu season to me, because she worked at a different hospital, and she says that people are lined up outside of the hospital sometimes in the ED because of the flu. And I'm like, we're not even seeing that for COVID right now. And I think a lot of it has to do with how we're ramping up on safety practices and like making sure that we're social distancing and making sure that like we're not spreading this disease any further than it already has, which is amazing, and which is like, it's really wise of Georgia. So I don't remember why I'm saying this.
No, because you were saying how previously you didn't have a full understanding of what the flu was like.
Yeah, right. So I think that because I'm seeing COVID firsthand, and because as a cardiac nurse, I never really saw the flu much. I wasn't really like engaged with what was going on with the flu and how it affects patients and things like that. But I'm seeing firsthand what's going on with COVID patients. So I think it's just hard for me to make a good comparison to flu patients versus COVID patients. But I will say I was for sure like, I think I was brushing it off because it hadn't hit Georgia yet. Or like maybe it hit Georgia and there was like one person. But I think I wasn't like realizing how quickly it could spread and that we would be in the same position that like Wuhan is in, especially for New York, you know?
Yeah. Yeah. In New York, I think it's a whole different story because one thing I recently read is funeral homes. There's so many bodies coming in and they don't know what to do with it that
Yeah.
they're literally renting out U-Haul trucks to store the bodies
Yeah.
in the U-Haul trucks until they can get to it. So
It's so crazy.
yeah. So we're so lucky that it isn't like that here in Georgia, but definitely need to be praying for New York. Have you heard
Yeah.
about the number of cases in New York? Is it going down at all, or?
I heard it's decreasing.
Okay.
And I heard the hospitals are getting better too.
Mm.
Like things in the hospitals are a little bit more manageable. But I've also heard crazy horror stories about nurses in the hospital in New York. Like I mean, they're getting paid a lot of money and they should be because they are walking into they're walking into taking care of patients and then getting COVID the next day. Like that's just the reality. And we had a nurse volunteer to go to New York. I mean, volunteer plus have the extra money,
Right.
but to go to New York and to help out. And she texted us back and she was like, I regret this decision. I should have come. And then she actually ended up getting COVID. And then she's stuck in New York for however many weeks.
Oh my gosh. Wow.
Yeah.
Wow. So you actually personally know people who went to New York?
Well, it was like a nurse on another floor who I heard about.
Right.
And she didn't text me specifically, but she texted our higher ups and then they were telling us about it.
Gotcha. So do you, for you, do you know in your hospital when they're going to start opening up to other like units again? So meaning, do you kind of know the end date for when you can move off of the COVID unit?
So they're in the talks right now of opening up different units, but they don't know when. So my unit's probably going to be the last to go. It's going to be the first one to open and the last to go because we have 3 cardiac units on our floor. So one is shut down, one is being used as a COVID unit, and then one is using it as a catch-all cardiac unit. So they're going to probably be fine with opening up the other unit and then having all the cardiac patients be there. So I don't really know when they're going to close down the COVID unit, to be honest. And I'm a little nervous about it because if I continue to work on this unit, then I can't go to church. I can't hang out with people. Like, let's say people start hanging out with their friends and they start going back to church and they start having hangouts and game nights and all that stuff. Like, I genuinely would not be comfortable interacting with anybody until I'm done working on the COVID unit because I'm literally being exposed, or maybe I'm not being exposed, but I'm having to take care of these patients and I may be exposed.
Right.
And I wouldn't know until it's like until symptoms start to show.
And feel free to not answer this question if you want, because it's kind of sensitive, but are you being compensated for being on this COVID unit or is your pay just the same?
No, they're compensating us, but
okay,
it's like, it's also indefinite. Like they aren't using it as like, they aren't. So there's this thing called hazard pay, but they don't want to call it that because this pay may be cut off at some point. It was actually supposed to be cut off in May, like May 1st, but they decided to keep it going. But I don't know when it's gonna like stop. So it was only supposed to be for a certain period of time.
Yeah. No, I'm glad to hear that because one of the things that I'm seeing a lot, a comment that a lot of people have been making is, hey, let's stop just calling these people, these frontline workers, heroes, and let's actually, do something to compensate them for what they're doing. And yeah, so I do think I agree, and I'm glad to see that there is some sort of compensation in place for you guys. But also the fact that you don't know when it's gonna end, that must weigh pretty heavy on your heart, right?
Right now, it's okay, but
Mhm.
as soon as I start feeling FOMO, for sure, it's gonna weigh heavy on my heart. Like it's okay right now because nobody else is hanging out, so
Right.
I'm okay. Like it's all good. But I think once things start picking up, I'm gonna feel like I'm genuinely gonna feel weird when our church starts gathering
Mhm.
and um like I'm supposed to be a leader, you know. I don't want to just be like I don't want to be seen as not courageous enough to come out, you know, or and I know people won't see me that way at
Yeah.
all.
Yeah.
But I don't know. I think FOMO is for sure real, and two, like, yeah, it is scary not to know when it's gonna end.
Mhm. Yeah. But on the bright side of things, though, have you been, because you look at some of the news stories across the nation, a lot of nurses, a lot of hospitals are, like food being sent, PPEs being sent and all that kind of stuff. Have you seen and witnessed or experienced any of that?
It's been amazing. It's the best. Every shift that I come onto, there's something new happening or something new that's being given to me.
Wow.
It's literally the best. I've never felt so supported and,
Wow.
and encouraged. I mean, one time, I think it was the Hawks Emory. It was like a compilation of a bunch of different companies.
Mhm.
They like gave us these brown bags to take home, and they were like 5-course meals. It was amazing. It was like, and it was
Wow.
good food. It was like salad, Italian meatballs, like this cheese and like veggie thing, and then like dessert. It was amazing.
Mhm.
So we've definitely seen a lot of support, and um, even like the patients. I had this one patient randomly like called this pizza joint, and so the way that things get delivered is it's delivered to our main lobby, and then they call our unit to say that there's something there to be picked up. I got this call, and they were like, "Oh, someone dropped off pizza for you guys," and I was like, "What?" And so I picked it up, and I found out it was my patient
Mhm.
who had given it to us. So yeah, we're getting a lot of support, and I've been getting so much free stuff from Instagram. And I got McDonald's almost every single day the other week, and I got free Krispy Kreme. What else? It's been amazing. It's been so good. And then Christina from the Collective Effect,
Yeah.
she gathered a bunch of people to give money for surgical masks and things like that, and we've gotten like over 700 masks even from just her alone, like
Wow.
rallying our community and like asking for donations, and um, it's just been really awesome to be supported that way.
Mm. That's good. Is there, do you feel like that is different from the amount of kind of societal support that you received before all of this happened?
um it's like completely different. I think it's I think that like people have this idea that like nurses are that nurses like being having a nursing profession is a special thing for sure. Like I think that people recognize the amount of work it takes to be a nurse, but I don't think people realize like um what kind of work we actually do on a day to day. And I think that um I don't know, it's our job, so I don't really expect to be like poured into in this way constantly and all the time. So
Mhm.
it's definitely different, but I'm not like upset about it. I'm not like um, butthurt about it.
Okay. Yeah, because
Yeah.
I think it's interesting when you come across a situation where you realize how essential someone who you've kind of just taken for granted is. And I always think about, I wonder if I show appreciation now will they feel like I'm only doing it because I'm, in a position where I need them? And
Mm.
like, how are they going to take it, right? So for you as a nurse, I was just wondering how you were taking the fact, because really the reason why all these free things are being given to you is because they recognize that you guys are fighting on the front line and they don't want to be on the front line, fighting the fight that you're fighting, right? Not only do they
Yeah.
not want to be fighting it, they can't fight it because they don't
Yeah.
have the proper skill sets.
Yeah.
So I'm glad though that you're not taking it in like a negative way, because yeah, that would be, I mean, I'm sure that just speaks more to your character than anything, and that you have a good personality. But because, yes, sorry, did you have something to say?
I was just gonna say, I think it's because everyone is being affected by it personally. Like
Mm,
every single person is being affected by COVID, whether or not they've gotten it. And I think that's the reason why people are being so appreciative. Because like when I see family members, like let's say like even like your dad, right? When something went something happened with your dad.
yeah,
Your dad
he
had
had
a
a
heart attack.
heart attack. Yeah.
Yeah. Like when something like that happens personally to your family and you see like the nurses and doctors working for your family member,
Mm-hmm.
it's affecting you personally. So it's natural to have gratitude in that way. So yes, we would get like donuts and like pizza and whatever and crackers and whatever from like people personally, family members who like are really just grateful. But the fact that it's hitting every single person who knows about COVID personally right now, I think that's the reason why we're seeing such a huge influx of like appreciation.
Yeah.
On top of the fact that they recognize that like we're putting our lives on the line by going into work.
Yeah. I just hope that this continues. I'm hoping, I mean, I've had 2 episodes in the past where the title was, I hope people, hear, like hospital patients hear about, how much work and sacrifices that nurses have to make, right? With you and another time with Nicole.
Yeah.
So I'm hoping that, because really, like you were talking about before with the flu, with any other disease or illness, it's not really different for the nurses, right? You guys, whenever you take care of a patient who has something that is contagious, you're putting yourself at risk for getting something, right? So
Right.
I'm hoping that people, their eyes are open now, but I'm hoping that they won't close their eyes to it in the future, and that they'll continue to see what great value, nurses add to our society, and that they continue to show this appreciation. So
Yeah.
I want to ask you kind of a controversial, I don't know, this might be controversial, it might not be, but I want to ask your opinion about Georgia opening back up, because at the time of recording, it's been around a week and a half since Governor Kemp said, these businesses can open up with certain precautions, right? As a nurse, do you feel like it was time to open up, or do you feel like we should have waited longer?
I think that we should have waited longer for sure.
Mm.
But I'm not angry. I mean, I understand like the um economic burden that this virus has caused, and the amount of people who are suffering more than the people, like there are people who of course suffer because of the virus, but there's people who are suffering economically that like I'm not really seeing firsthand, because I'm not like I'm not in charge of those small businesses, but I'm sure, like I've heard a lot of stories about several small businesses being um, completely, what's that word? Like
Shuttered, closed.
yeah, because of this. So I can understand the hard decisions that Governor Kemp had to make.
Mm.
I still think he should have gone a little bit longer. And I haven't really been looking at all the statistics of how COVID has been affected in Georgia, because I just realized like the more that I look up and the more news that I hear, the more I don't want to go into work.
Yeah.
And I don't, and also like sometimes I don't believe in certain things that are being said. So I just do my job and like try to do it well. But yeah, I feel like it should have gone longer, but I also understand his decision in the sense that like he's trying to manage the heartache and the burden that has been that many people have been affected by, but also trying to figure out a way to make sure things are safe for our state. In terms of like making sure there are no gatherings and still like bars and open areas and things like that, or like small spaces are not being crowded and things like that. So I mean, I understand his decision, but I don't necessarily agree with his decision.
Gotcha. Have you, in your unit, you haven't seen an increase in patients yet, right? Or have you? Since the opening?
It's kind of hard to tell because we have 4 units. It's kind of like constantly going in and out in waves because like I said, we typically get the dialysis patients.
I see.
So it's kind of hard to tell, but I haven't really seen a huge decrease or a huge increase in any way. It's kind of been the same for the past like 2 months. It was really bad in the beginning because we were the only unit, so our unit was constantly full all the time. And then once those other units opened up, it was like half of our unit was full, and it's been like that for several weeks now.
Gotcha. Wow. So let me ask you a kind of a lighthearted question. What is the first thing you want to do once all of this is over? Let's say, the cases start dying out. Let's say if you get a vaccine and you can go out and freely hang out with people, do whatever you want. What's the first thing you want to do?
I want to go to 770 with Junie and Jane.
Oh, 770. For those of you guys who don't know, it's a Korean barbecue spot. Really good. Yeah.
We joke around about it all the time because it's like our favorite double date spot. But it's literally the best. Like every time we go, it's like everything in my body is satisfied.
And it's interesting you bring that up because most restaurants you can do takeout, but you can't really take out 770 because you
really can't.
Yeah, you have to grill the meat on their charcoal grills and all that. So
exactly,
that's a good one. Yeah. 770.
Or yeah, I was gonna say, or go to a coffee shop by myself and like just watch people. Like I love going to the coffee shop and like journaling and meditating and like reading. But the reason why I love going to coffee shops is because I'm like I become awake to stimulation. Like I'm definitely an extrovert in that way, in the sense that like I become more alive when I see people like in their busyness and I see people like active and things like that. So just being in a coffee shop, watching people be active and like me being active in my mind and my body, my soul, and just like meditating, and yeah, I would love to do that.
Do you have any words or anything you want to share with people that have been supporting you guys, as in like, I don't know, if you could send a word to, I don't know, someone who gave you something really nice while you were working at St. Joseph's? What would you tell them?
I would tell them that it has completely shifted the way that I enter into my day, because I know that despite the sacrifice, which honestly it doesn't feel like that big of a sacrifice to me because Georgia isn't being hit as nearly as bad as New York. And we definitely are being like supported by our chief nursing director, chief nursing officer, and our acute care specialty director, and all of our bosses and everything managers. But when people show their support and give us free food and give us fabric masks and continue to support us, it gives us that much more like courage and that much more energy to get through the rest of the day. Like we as a team become even more unified because we're happy over one thing together, if that makes sense.
Wow,
Like
wow.
we get to be joyful about one thing together. And I've seen my team be like crumbling in pieces and then someone bring in something and we're all like, let's all go to the break room, have a donut and go back out there. Like it really just gives us that boost of energy that is so necessary when you have a 12-hour shift.
Mm.
And for me personally, like one thing that I've realized for the past like couple months is that I have an overwhelming amount of gratitude for the people who, for just like my life in general, and for the community and the friendships that I have. And like having a heart of gratitude can combat any kind of anxiety, because in anxiety, like you feel a lack in your soul. Like you feel like this place of like you have like you're out of control almost, and this like fear that overwhelms you. But I feel like when we're able to have gratitude and thankfulness, it's like an easy weapon to kill off anxiety as like immediately.
Mm.
So yeah, all that to say, like I'm just super grateful, and you guys are the best. Everyone is the best. Everyone is so good.
That's awesome. Yeah. So to anyone, wondering, I mean, what will a meal do? That's what a meal can do. That's the effect that a single meal of encouragement. It doesn't even have to be a meal. Selena said a donut. By the way, that bacon donut that you had on your Instagram not that long ago, that looked
So
so
good.
good. Yeah. But something like that, it can like brighten a whole group of people's days, especially people who are, I mean, specifically a group that is, fighting for our safety on the front line. So if you're considering it, if you're thinking about it, I would say go ahead and do it, because you now know that it will have a tremendously positive effect. And yeah, showing appreciation for people doing the things that we definitely don't want to be doing, I think it's always a good thing to do. Um, we're almost at the hour mark. Any last thoughts or words that you want to share, Selena?
Stay safe. I am just, I'm ready for this to be over. And I know that people are itching for this to be over. But yeah, I feel like keep connecting with people. Don't isolate yourself. Keep maintaining your community and catch up with your friends during this time. Just take advantage of this time. Like as much as like, you know how people are working from home and I can't really work from home. It's still like I still have so much time to rest because I'm not like spending all my time hanging out with people or doing schoolwork or whatever. But I have so much time to rest, and it's been such a special season. And Connor's like constantly asking me to not put this pressure on myself to be extra productive, but at the same time, like I do want to take advantage of this time as much as possible. So yeah, I just want to share that like this season is so special, and I think that even though there's so much darkness around it, there's also a lot of opportunity around it too.
Yeah. And I will say, I kind of agree with Connor in the sense that, of course, being productive is great, but I think you should realize that you are doing extra, at work. It's not just a regular day at work for you.
You're right.
So don't forget your mental health, and just relax and re-energize at home, because you are running a marathon, right? Because at my work, we always talk about COVID-19, how it's impacting us financially. And our CEO always says this. He says, hey guys, this isn't a marathon, because I'm in a marathon, and you'll know this, in a marathon, the distance that you have to run, right?
Yeah.
So like it's easier when oh, I only have a mile left to go. So like it gives you that extra bit, but because we don't know the distance that we're running,
Yeah.
it's a totally different thing mentally. So I would encourage you to stay home, relax, and don't put that extra pressure on yourself to be more productive, because you are doing plenty, Selena.
You're right.
So guys, if you have any questions or if you have any thoughts with regards to what we talked about, with Solina today. Please feel free to email me any questions or any thoughts at IHTHTpodcast@gmail.com, or message me on Twitter at I hope they hear this. Oh, sorry. Message me on Instagram at I hope they hear this, and on Twitter at IHTHT podcast. And please, if you're appreciative of our frontline workers, please, I think even a simple message of appreciation to Solina would go a long way. So if you want to send it to me, I'll more than gladly relay it to Solina, or check us out on Instagram, and I will have Solina tagged on this post. So you can message her directly if you want. She is a warrior. We are very lucky to have her. So yeah, if you feel the urge and the need to do so, please don't fight it. Well, Selena, thank you so much for being on. Thank you so much for your insights. And
Wow, thank you so much for having me.
And most importantly, thank you for what you do, because really without you, we would all be sick and dying and are. Yeah. Well, thank you guys for listening, and we'll talk to you guys next time. Bye.
Bye.